1 in 3 American mothers are faced with the daily struggle to provide clean, fresh diapers for their babies. Huggies, together with the National Diaper Bank Network, is combating this need to strengthen communities and ensure all babies get the hugs they need.
We take the diaper out. You want to have everything ready, and all you do is you close.
Labor and delivery centers like this one at St. Vincent Hospital in Bridgeport, Connecticut, keep a close watch on the health of babies and their mothers.
She's beautiful.
And it's the trust developed between the nurse and their patients that's so special.
If I didn't trust the nurse, I would have never divulged anything. She wouldn't have known that I was basically in a financial crisis. She wouldn't have really known that, I really don't know what I'm going to need when I go home.
And what Natasha Rivera-Labuthi needed was diapers. When she gave birth to twin girls, one of them had a milk protein allergy and required special extensive formula. This on top of a 2.5-month hospital stay.
It was choosing between, am I going to put a clean diaper on her, or am I going to give her her formula that's life-sustaining?
Times were tough, but she says her nurse guided her to a real solution. Diapers from the Diaper Bank in New Haven. With 1 in 3 families unable to provide clean, dry diapers for their babies. It's through national incentives, networks, and diaper donations that's helping fight diaper need in communities throughout the U.S.
It wasn't just diapers that I was receiving, it was just the environment that she helped put me in was very nurturing.
Diaper need is a growing problem here in the U.S. that impacts the well-being of babies and their families. And that impact is widespread, physically, emotionally, and economically.
Folks understand about food banks and housing vouchers, but what they don't realize often is that there's no public subsidy or federal subsidy or state level subsidy for diapers. We are one of the largest diaper banks in the country, but we know that we're scratching the surface of need.
Joanne Goldblum, CEO of the National Diaper Bank Network, feels strongly about this mission.
When I talk to moms and dads and grandparents and caregivers, they're grateful, but they're grateful for the opportunity to be able to take care of their child as they know they should be doing. So what we're really doing is trying to even the playing field a little bit so that every child has the chance to start at the same place.
From just the physical aspect, we know that when a baby has to stay in a diaper too long or potentially has to wear a reused diaper, they're much more higher risk of being exposed to health risks such as diaper rash or irritation or even infection. The bottom 20% of families spend as much as 14% of their income on diapers.
And we know that about 44% of American children are poor or low income. That's a lot of families who struggle financially.
Huggies is so excited to be partnering again with AWHONN nurses in the Healthy Mom and Baby Diaper Drive. Our goal this year is to collect 1 million diapers to help support the National Diaper Bank Network. And that's in addition to the more than 20 million diapers that the Huggies brand donates each year.
Huggies is the founding sponsor of the National Diaper Bank Network. So far, they have donated more than 200 million diapers and wipes to babies in need.
So it means that families can't go to work. It means that children aren't able to attend daycare because they have to bring a supply of diapers with them when they go. It means that babies' health is at risk because families are reusing diapers or keeping them in a diaper for too long.
One of the things that nurses bring that I think is so valuable is that being the first contact with new parents, both prenatally and once the baby is born. So nurses are really able to help parents to be able to understand how to best take care of their baby. And sometimes for families who are struggling, one of the things they need is access to diapers.
The fact that moms have to struggle and recycle and reuse dirty diapers at times was just overwhelming for me.
The nurse manager at St. Vincent's Family Birthing Center said it was a Huggies-sponsored presentation at the 2016 AWHONN conference that made her aware of the existence of diaper need in communities throughout the country.
As a human, as a nurse, as moms, the mental effect of not being able to supply that, just a diaper.
She's gorgeous. Who's that cutie pie?
The psychological impact of not being able to supply a diaper has such a trickle-down effect. If you can't supply a diaper, how it may make some women question their parenting skills altogether, and that's really unfortunate.
It's through partnerships with the NDBN and working closely with nurses that Huggies is reducing diaper need in many communities, helping babies and their families get all the hugs they need to thrive. In Connecticut, I'm Danielle Elias.